After 67 days, more than double Maryland's 30-day disclosure deadline, the state finally turned over these records. More than 100 internal documents from the Maryland Department of Healthcare Quality shows agencies knew unlicensed assisted living homes were exploiting and trafficking seniors and were trying to stop it in 2023, and then they stopped. One internal meeting note says senior trafficking and unlicensed assisted living homes were getting worse, calling their operators fraudsters. Despite that warning, records show no sweeping enforcement, no coordinated shutdown, and no sustained oversight. As a result, vulnerable seniors, many poor, disabled, and without family support, continue to be moved between unlicensed homes and used for government benefits such as Social Security and disability payments.
I want to thank you for taking the opportunity to spotlight this issue.
I give you credit for identifying this issue and lifting it up.
The public records contradict what two Maryland senior officials told Spotlight on Maryland that our reporting alerted the state government to the senior trafficking crisis.
Some have said in the state of Maryland, unlicensed assisted living facilities is a form of senior trafficking and a crisis. Would you agree?
So first, I want to thank you for taking the opportunity to spotlight this issue and allowing me to talk about it. I think what I can say is within Public Health Services at the Department of Health is the Office of Healthcare Quality. We know that this is an incredible priority for the department. When we receive information or a complaint about an unlicensed facility, it's something that we take very seriously, and we go out and investigate and make sure that we're taking appropriate action.
But the documents show that the state had that information and then backed away. We pressed Governor Moore's senior advisor and communications director, David Turner, on New Year's Eve.
When did the governor become aware that unlicensed assisted living facilities were operated in the state of Maryland?
I think that is something that has been below the radar, and frankly, to be honest, your reporting has elevated it, and I think it's an important issue, and I give you credit for identifying this issue and lifting it up.
State records show that statement was not accurate.
Public documents and records show that this is something that actually the government knew for quite some time. Why the disparity?
I think because the governor isn't governing. He's running for president. I mean, he's really asleep at the wheel.
Maryland Delegate Mark Fisher, a Republican member of the House Government Oversight Committee, says this should trigger an immediate investigation.
We have potentially seniors who have their SNAP benefits ripped off. We have their Social Security money ripped off, and we have unlicensed centers that are not even taking care of these seniors, because I think they know that there's an enormous amount of fraud going on at every level in this government in the state of Maryland.
A Democrat on that same committee agrees action cannot wait.
Recent public records that we received show that the Department of Health initially started to engage in enforcement back in 2023 and then pretty much stopped. What's your reaction to that, and what do you plan to do?
And again, it's very upsetting, disappointing. I'm not going to sit here and pretend that like this, when you hear about these things, it's heartbreaking because, again, nobody, like foster kids, nobody ever thinks about them until an incident happens. So, yeah, it's very heartbreaking, and I don't know if it's manpower or lack of oversight, but either way, we're going to get to the bottom of that.
The Office of Healthcare Quality has a big mandate. It is a big job to make sure that everything is going the way it's supposed to be in our healthcare system.
Outside the State House, Delegate Teresa Warman, who sits on the House Health Committee, says she will push legislation this session to force greater oversight of the Office of Healthcare Quality, including a stakeholder advisory board.
The executive director, per our sources, has mentioned to her staff that she doesn't want an advisory board at OHCQ, and she said that it's, something that's just completely unnecessary. What would your message be to her?
Well, if it was unnecessary, I don't think we would see a lot of the issues that we have right now, and that sometimes we have to step outside of the bubble that we're in and take a step back and see, what is needed.
The Office of Healthcare Quality, in your opinion, is it actually being managed and led correctly?
Yeah, of course not. The Office of Healthcare Quality is doing whatever the governor tells them to do, which is to not investigate anything until after the election.
We attempted to ask Governor Wes Moore what he thinks.
Governor, do you stand by OHCQ's enforcement record? Governor.
Spotlight on Maryland will continue to press for the records the state is still withholding and for answers about why action stopped while seniors remained at risk. I'm Gary Collins at the State House in Annapolis for Spotlight on Maryland.
If you have a story tip for our Spotlight on Maryland team, you can call 410-467-4670 or email them at spotlightonmaryland@sbgtv.com. Hi, I'm Maxine Stryker. Thanks for watching. Don't forget to like this video and subscribe to our channel, and check out Fox Baltimore on social media to find more stories like this.